Hello, welcome to any community. What are the significance of Purvarupa? What will be the importance of Purvarupa in terms of the treatment, in terms of the assessment of the prognosis, and in terms of the assessment of differential diagnosis? In other words, what may be the importance of the Purvarupa in terms of the Chikitsa Sutra assessment, in terms of the Sadhyasathyata assessment, and in terms of the Sapeksha Nidana Vyavacchedaka Nidana assessment? That will be the discussion of today's video. Dear ANA community, put a thumbs up and spread this particular video to maximum number of true Nidana learners, so that the algorithms of the YouTube will be fetching you the right video at the right time for the right purpose as such. So when you think about the Purvarupa, which is being termed as the Pragrupa, or sometimes it is also being termed as Purahasara, in the current conventional medicine, what we can say, it could be a prodromal symptoms or premonitory symptoms. So that means these are the clinical features observed before the clear-cut manifestation of the lakshana or the symptoms as such. So when you think about the significance of Purvarupa, we need to know about what may be the nature of the Nidana Sevana and their pathological events. We need to know about it. When you think about the timeline of Nidana Sevana, that is exposure to Nidana, and the different events taking place, so that is, when you think about there are the 5 different days. In that particular sense, on the first day, the person is having the exposure of Shitavata. So that means the cold air atmosphere is going to take place in the respiratory passages. In that particular situation, the early clinical manifestations observed will be in terms of the pranavaha srotas, what we can say the respiratory system's affliction may be observed from the beginning. So from the second day onwards, the person will be having the kasa. Due to the dryness of the respiratory mucosa, etc., the person will be having the dryness of respiratory mucosa, or which may be responsible for the irritation. Thereby the person will be having the cough. As the early manifestation of the symptoms as such, because of the exposure of the cold air, there will be the dryness of the respiratory mucosa will be taking place. Thereby the person will be having the less amount of the sputum production. When you think about the third day, he is going to consume the Dadhi Sevana. Plus he is having the Shitavata Sevana also, probably staying in AC room as such. In that particular situation, there may be a possibility of Tvak Sankocha. So that is what we can say, the peripheral vasoconstriction may be taking place. But this will be responsible for further, as the person will be having the, again, cough may be there, but here the person will be having the Bahunishtiva. The person will be having the large amount of the sputum that will be produced. And on the fifth day, the person is developing the Jwara, or what we can say, the person is having the raised body temperature. Usually at this particular time period, the patients are going to visit the doctor as such. In that particular situation, the Jwara can be considered as the Rupa as such, whereas the Lakshana that were being observed, that is Kasa or Alpashthivana or Bahunishthivana, or what we can say the Tvak Sankocha, etc., we are going to say they are the Purvarupa, or what we can say the prodromal symptoms or premonitory symptoms. This how we can able to understand the Purvarupa. In the sense, any Lakshana, what we can say, if the person is visiting the doctor and if he is observing any of the Lakshana prior to visiting the doctor as such, we can say that could be the Purvarupa as such. Or in other words, we have to think about the what kind of the srotas is being afflicted. As I based on that, we can able to predict the possible Purvarupa manifestation in an individual. Now, why we need to know about the Purvarupa as such? Kevalat nidanat na vyadijnanam bhavati iti Purvarupadinam upadanam iti vapyachandraha. Madhukosha commentary says, only by knowing the information on Nidana, that is what we can say the causative factor, the complete knowledge about the disease may not be possible. Hence, we have to look into the Purvarupa, Rupa, Upashaya and Samprapti also. Based on that, we can able to make the diagnosis of the disease accurately. For example, the person is going to consume the Ruksha Bhojana, what we can say Ruksha Ahara. So that is what we can say the consumption of the poha, etc. We are going to say. In that particular situation, there will be the increase of the Vata dosha is going to take place in the Mahasrotas. In a sense, initially the person will be having the the dryness may be happening in the mouth, which may be leading to the thirst or frequent water consumption may be observed. And when the particular Ruksha Ahara entering into the Amashaya, etc., so that will be responsible for the increase of the Vata dosha is going to take place in the Mahasrotas itself, that too in the Amashaya, what we can say the stomach. Later, we are going to observe the increase of the Ruksha Guna in case of the small intestine, etc. So that means the consumption of these Ruksha Ahara, so that will be leading to the increased absorption or the movement of the fluid taking place from the intravascular compartment to the alimentary canal as such. In that way, so there may be a possibility of the Ruksha Ahara that may be taking place in the Mahasrotas earlier, and in some of the occasions, so if the person is having the Ruksha Bhojana may get sticked in the mouth itself, that may be a possibility of affliction of Pranavaha Srotas. If the person is going to consume more amount of the Ruksha Ahara frequently, so that will be responsible for the influx of the fluid from the intravascular compartment to the alimentary canal. Thereby, there may be a possibility of affliction of Rasavaha Srotas may going to take place. As the person is having the more amount of the secretion going to take place in the stomach or small intestine, large intestine, etc., there may be a possibility of the affliction of Annavaha Srotas or Purisavaha Srotas may also going to take place. In that way, the consumption of Ruksha Ahara, so that will be leading to the increase of the Vata dosha. So if that is the case, then there will be the Purvarupa may be observed. In case of the Pranavaha Srotas as such, there may be the possibility of Rupa may be observed. In case of the Annavaha Srotas as such, there may be a possibility of Upadrava that can be observed in Rasavaha Srotas as such. There may be a possibility of the Upadrava may be taking place in case of the Purishavaha Srotas as such. There may be a possibility of Arishta in case of the Rasavaha Srotas as such. In that way, we can able to make out the possible distinctions in terms of the Purvarupa as such. That's why the knowledge of these informations, that is Purvarupa, Rupa, Upadrava and Arishta, etc. are very, very essential. In that particular sense, whenever a person is visiting the doctor, if they are saying any of the Lakshana prior to their visit to the doctor as such, wherein we can able to observe the Lakshana related to the similar Srotas before the interaction with the patient as such, we can able to say that could be the Purvarupa as such. And when you think about the significance of it, the first and foremost significance is to plan the actual line of treatment as such. Whenever, if you are saying the jwara as such, that is mainly if the person is having the jwara purvarupa, in that particular situation, lakhvashanam apatarpanam va. So that is lakhvashana in the sense the light food intake, maybe simple hot water intake, or maybe simple, what do you say, that rice gruel intake as such, or simply maybe the mudga ahara, what we can say, the horse gram no, green gram items as such. In that way, so lakhvashana, apatarpana, in the sense the measures which are responsible for the lightness of the body as such, that is the simply the keeping the fasting, etc., etc., which are leading to the lightness of the body as such. So whenever if you think about this laghvashana and apatarpana, it is indicative that there may be a possibility of the presence of ama in the amashaya. For that reason, Lakhvashana and Apatarpana, they are responsible for the Amapachana that is going to take place in the Amashaya. Hence, if you are knowing about the Purarupa of Ujvara, we can able to plan the Lakhvashana or Apatarpana. But planning the treatment in case of the Jvara Purarupa is very, very difficult. Because whenever a person is visiting the doctor, they may be in the state of Rupa Avastha, not in the Guru Rupa Avastha. Hence, the planning this Lakhvashana and Apatarpana in case of Jvara Pururupa can only possible in case of the family members who are visiting the doctors as such. That too, close family members whom they are continuously monitoring. In them, they can able to observe the Pururupa of the Jvara, etc. In them, we can able to plan Lakhvashana and Apatarpana. And the second significance of the Pururupa is, that is to determine the Sadhyasathyata. It is being mentioned in the Charaka Sutra 10th chapter, Hetavaha Purarupani Rupani Alpani Yasya Vai. So that is in terms of the Sukhasadhya Vyadhi Lakshana, wherein Nimitta Purvarupanam Rupanam Madhyame Bale, which may indicate the Krishna Sadhya Vyadhi Lakshana. So that is, whenever if you think about it, if the person is having the mild form of Purvarupa, or the Lakshana will observed, that is prodromal symptoms observed for the localized lesion, for the very small part as such, that is indicative of Sukhasadhyata of the disease as such. Whereas if the person is having the Pururupa is observed in much larger areas of the body, so that may indicate somewhat Krishna Sadhyata of the disease as such. So here there are the two individuals, female patients as such, wherein the patient X on the left side, so she is having the lower abdominal discomfort. So, or that is indicative of a milder form of the Pururupa. So, both of them are presented with diarrhea. In that, the Miss X, she will be having the mild form of the Pururupa, wherein the Miss Y, she is having the severe form of the Pururupa, wherein the clinical features observed on large part of the body itself, abdominal region. For example, pain in the Hridaya Pradesha or the retrosternal region, pain in the umbilical region, pain in the lower abdomen, pain in the rectum, pain in the anus as such. So that is indicative of the presence of the Pururupa, that is what we can say the in more larger area of the human body. That's why here it could be considered to be a severe form of the Pururupa if the both of the Miss X and Miss Y are presented with Atisara, what we can say the diarrhea. The third significance, that is if to determine the Sadhyasathyata. if the person is suffering from Jwara, if they are having all the Purvarupa that is being mentioned in the text, Purvarupani sarvani jvaroktani atimatraya yam vishanti vishatyena mrutyurjvara purahasarah. When you think about it, all the Purvarupa mentioned in the Jwara that is being mentioned in Sushruta Uttara Tantra, Shramo Aratir Varnatvam Vairasyam Nayanaplavah Ichhadvesho Muhushchapi Shitamata Tapadishu Jrimbhanga Mardo Gurutaro Maharsho Archistamaha Apraharshashta Shitam Cha Bhavantyatpatsiti Jware Samanyatah. So that is, if the person suffering from Jwara, if they are having all the Lakshana mentioned in the Purvarupa context of the Jwara, then that particular type of the disease is considered to be asadhya in nature. Sometimes it may be sometimes life-threatening also. To make the differential diagnosis, when you think about the differential diagnosis as such, the text says, Charaka Chikitsa 6th chapter, Haridra Varnam Ridhiram cha Mutra Vivna Pramehasya hi Purvarupaihi Yo Mutra Yettam Navadet Prameham Raktasya Pittasya hi Saprakopah. Haridra Varnam Ridhiram cha Mutra Vina Pramehasya hi Purvarupaihi Yo Mutra Yet Tam Navadet Prameham Raktasya Pittasya hi Saprakopah. So that is, whenever the person is having the reddish colored urine, there are two possibilities. That is, either there may be a possibility of Rakta Pitta, there may be a possibility of Pittaja Prameha. When you are having the differences, that is the doubt, in that particular situation, we have to observe the Prameha Purvarupa, which is being mentioned. Dantadina maladhyatvam pragrupam panipadayo dahashtikkanatadehe tridusvatvasyam chajayate. Whenever there is the more and more accumulation of the mala or tartar in the teeth, etc., or more wax accumulation in the ears, etc., or more sweat is being produced, etc., and the person is having the burning sensation in the pani and pada, that is palm and sole, and dahaha, that is the burning sensation, chikkanata dehe, which is considered to be sliminess or the of the body parts, plus they are having the thirst, that is the thirst as such, and sweet taste in the mouth. These are considered to be prameha purvarupa. If the person is having the yellowish colored urine or reddish colored urine, along with the presence of the prameha purvarupa, then we are going to make the diagnosis of prameha. In the absence of prameha purvarupa, if the person is presented with haridra varna or rudhira varnaja mutra, that is yellowish or reddish colored urine, then we are going to make the diagnosis of rakta pitta, specifically adhoga rakta pitta. It is not the prameha. Hence, the significance of the purvarupa is also helpful in making the differential diagnosis as such. To sum up, the knowledge of Purvarupa is specifically helpful in planning the appropriate line of treatment. Plus, it is also helpful in determining the Sadhyasdyata of the illness, or what we can say the prognosis of the disease as such. Plus, it is also helpful in making the differential diagnosis of the presenting complaint. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mentioned in the comment box below. And what is the one video that you'd like to hear in the coming days in this particular channel? Mention in the comment box below and spread this particular video to maximum number of 2 Nidana learners so that we can make a huge movement out of this particular small message. Don't forget, put a thumbs up, put the bell icon, and so that the YouTube algorithms will fetch you the right kind of the videos, that is for the right purpose at the right time to you, so that you are going to get the maximum benefit out of this particular small videos as such. That's all for today. Something more in the next video. Thank you.